Bending the epidemic curve for COVID-19, while tough on all of us, was pretty straightforward. Social distancing, testing, contact tracing, isolation and quarantine. With mental health, and in particular youth suicide, it's much harder.
It is entirely possible to actually predict deaths by suicide, just like deaths from the virus, by modelling those factors we know will lead to deaths, particularly in young people. All of these have gone through the roof in the last 6 weeks.
The factors which affect youth suicide rates include unemployment, completion of education and training, and how connected a young person is with friends, family and services. Associate Professor Joanne Atkinson heads a team that leads the world in modelling mental health issues such as suicide.
We ran 2 scenarios, a conservative scenario that assumes an unemployment rate of around 11%, with youth unemployment reaching 24%, and a 10% reduction in community connectedness, as well as a more pessimistic scenario that assumes the unemployment rate will reach as high as 15.9%, with youth unemployment at almost 35%.
That bigger rise in unemployment, which could happen, would mean an increase of 53% in suicide, which translates to 261 deaths in just one region, in this case the north coast of New South Wales.
And these forecasts point to the possibility that we could see more lives lost to suicide in this one region alone than we will see nationally from COVID-19.
Federal Health Minister Greg Hunt knows well the importance of factors like income and employment on mental health.
We're already using the work of the Sydney University, the Brain and Mind Institute. That work, that predictive modelled work, is fundamental to what we're currently doing, and it's informed our COVID response of the services we're providing, the economic support we're providing, and then the path back to recovery.
Modelling can also help you to avoid making mistakes in how you spend your money. For example, Joanne Atkinson's group modelled investing in teaching the community about mental health as well as teaching general practitioners. Now that made a lot of sense, but in fact on the model it made things worse. The reason being was that you created demand which services couldn't cope with. You had to invest across the system. With COVID-19, governments looked at Australia's healthcare resources as a whole, both the public and private sectors, because the private system has skilled resources that can be mobilised quickly.
The same can be done in mental health. The states do a great job through their public hospitals and through their emergency departments, but they're at the bottom of the cliff. They are the end point. The minister needs to directly purchase at the top of the cliff the extra specialist capacity to stop people falling to that degree.
So I'm not just willing, but I am very focused on continuing to work with mental health professionals, with consumers and the private hospitals and private health insurance sector on further reforms, and I'm completely committed to transforming mental health care.
Historically in mental health, we've had a scattergun approach to funding. We have many, many new initiatives every year. It's not coordinated, it's poorly delivered, and at times new initiatives actually undermine other initiatives that are being rolled out at the same time. And that partly underpins why it remains so chaotic and frustrating for governments.
The National Pandemic Mental Health Plan frankly came out of a National Cabinet discussion between mental health ministers. Look, we're always responsible for what happens across the country. We're going to fight for all of those. Each life matters.
So it's good to hear that there might be teamwork on suicide reduction moving forward. And don't forget, Lifeline is on 13 11 14, and the Beyond Blue coronavirus service can be rung on 1800 512 348. It's really important that you ask people you care about whether they're okay. And if they or you are feeling distressed, seek help.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.